Hello and welcome to tonight's webinar, Flexing to the Next Level, Tips and Techniques on Optimizing Your TruSculpt Flex System. Tonight's presentation will last for approximately 45 minutes, followed by a 15-minute question and answer session. Questions can be submitted through the questions feature located on your screen. Please send all questions to the host. Tonight's presenter is Elisa Hofmeister, Cutera's Director of Product Marketing. Elisa has been with Cutera for a little over 2 years, and in her time with Cutera, she has personally managed the body market, launched both TruSculpt ID and TruSculpt Flex. She also oversees Cutera's product marketing team. Elisa has a breadth of industry experience, having worked for other laser manufacturers since 2006 in the past in both sales and marketing roles. And at this time, I would like to turn the session over to my colleague, Elisa Hofmeister.
Thank you, Gina, and thank you all so much for joining us. Today we're going to review the technology of the TruSculpt Flex, which most of you are very familiar with. But instead of just going over what is it and what does it do, we'll spend some time also reviewing how does it work, which is where we seem to have received a lot of questions. We'll also do a review on the treatment protocol, everything from the patient selection and setting expectations, treatment markings, placing the true gels and handpieces, wrapping, and treating the actual patient. Also the post-treatment steps and cleaning the handpieces and the device when you're done. It's always good to do a quick reminder on the importance of taking good before and after pictures, and also to go over the cycle refill process. So we'll go through all of those items on today's webinar. So let's begin with the technology overview. As I mentioned, this first part is a quick reminder and review of what you probably already know about the TruSculpt Flex. The TruSculpt Flex mechanism of action has 3 different components to it. The first is the bioelectrical muscle stimulation, which is a direct versus indirect stimulation for high intensity and specificity with up to 30 milliamps of energy. Most of the other devices on the market have an indirect stimulation, so ours is very unique that we can select exactly which muscle we want to contract. We can change the direction or the polarity of the contraction, and all of this is giving us enhanced comfort and efficacy based on our handpieces and the true gels that we use as a medium for conducting the energy. With True Control, we're able to do exactly what the name says. We're controlling everything about that energy delivery. So we can target the select muscle groups, not just a general area. We can customize the current delivery and the intensity of it. And we have less energy that's being wasted. So we're able to really maximize what we're doing to that muscle in order to optimize the result. It's also very safe and consistent between operators. Multidirectional stimulation is the last component of our mechanism of action. This offers 3 different treatment modes, prep, tone, and sculpt, which I'll go into on later slides. And we're creating multiple types of muscle contractions. And again, in these next few slides, we'll explain exactly how this works. And we treat up to 8 areas all in one session. Let's take a step back and look at first how our muscles work during normal exercise. Generally speaking, if you were at the gym and you were working out, your brain is going to send a message to the nervous system triggering your motor neurons. And that sends an electrical signal of less than 1 milliamp of energy to your muscles. So with a very low amount of energy, you can contract your muscles. So for example, if you were doing sit-ups, your brain would tell your body basically it's time to crunch. With TruSculpt Flex, the Flex machine becomes your brain, and it's telling the motor neurons that it's time to contract the muscles. So it sends a signal of 30 milliamps of energy, so it's 30 times stronger signal through our handpiece and our true gels, telling your body it's time to contract. So we're simulating exercise by using electrical stimulation. With bioelectrical muscle stimulation, the muscles are stimulated by the electrical current utilizing multiple different frequencies. So you have the carrier frequency as well as the beat frequency. The carrier frequency does exactly like the name says. It's carrying the message which is allowing for selective targeting of motor neurons to contract your skeletal muscles. So this is how exactly the sending of electrical signals to the muscle makes the muscle contract. But on top of that, we also have what's called the beat frequency, and this is a range that determines how those muscles contract. So it's not only just how many beats per second or how fast the muscles are contracting, but also we're able to control in what direction those muscles are contracting. The contractions are, however, staggered. So you've probably noticed when you're doing a treatment that not all of the muscles are contracting at exactly the same time. So they'll start, for example, on pair 1, and then the contractions will move to pair 2, to 3, and so on. So those are all staggered. You can, of course, control your intensity of those contractions based on the machine. You're increasing and decreasing the intensities, which is simulating what you would do with weight. So if you were at the gym and you were, with each time you worked out, you increased the amount of weight that you were adding on a given exercise, we're simulating that, but we're not using real load or real weights. We're just using the intensity from the device itself. So because we do this, there is no lactic acid buildup because we don't have an actual load on the muscle. However, some patients do experience muscle fatigue or muscle soreness after the treatment or the day after the treatment, and really what they're experiencing is what we call DOMS, or delayed onset muscle soreness. And this is really just your body's way of adapting to a new activity. The next unique component to the TruSculpt Flex is how we're able to change the directionality of the contractions. So not only can we place our handpieces vertically, diagonally, and sequentially, that's determining how the muscles are actually contracting. So let me go into that in a little more detail because we get a lot of questions on exactly how does this work and how is this happening and why are we not just staying within one pair of a positive and negative to send the energy back and forth, but we're also going between all 4 handpieces. So when you're in the prep mode or the beginning part of the tone mode or the beginning part of the sculpt mode, your handpieces are sending signals back and forth between your positive and negative. And the way that works, and you can see on the pictures that there's a positive, the different voltages. And in your positive handpieces, your voltages are the same, they're equal, so they don't attract each other. But to the black handpieces or the negative handpieces, the voltage is also equal amongst the black handpieces, but it's a lower voltage than the positive red handpieces. So the attraction between the positive and negative create an effect of sending energy back and forth when you have between that channel, or all 4 of those handpieces, when the reds have a higher voltage than the blacks. Conversely, when you're in the ending portion of the tone mode or the ending portion of the sculpt mode, and when I say ending portion, that's the last 15 minutes roughly of tone and roughly 30 minutes of sculpt, the energy is actually moving in a sequential fashion because no longer are the positive energies equal and the negative energies equal. Now all 4 of the handpieces have different energies, starting at 1 being the highest and moving all the way around to 2 red being the lowest. So that energy is going to move in a square-like formation based on the attraction from each voltage, the voltage in each handpiece being higher in the handpiece next to it. So here's a nice image just to kind of give you a visual of how the prep mode, the tone mode, and the sculpt mode are similar and different. So basically, when you go to the gym and you work out for 45 minutes, nobody would ever do the exact same exercise for the entire 45 minutes. The idea is to do multiple different things to challenge your body. However, when you're just getting started, you might do just one thing, and that's really a conditioning. So our prep mode is our conditioning mode, and there's basically a frequency that's being used in the prep mode that's being repeated throughout the entire 45 minutes to condition your muscles and get your muscles ready for your tone and sculpt modes where it's more intense. It's important for a patient that is not very active to start with the prep mode, because the whole goal with the TruSculpt Flex is to get to the highest tolerable intensity. And if you haven't prepped the muscles, your intensities on the tone and sculpt mode will be at a lower level, which can compromise your outcomes with the Flex treatment. So you would start your first 2 treatments with prep mode if you are not an active patient. Once you move into tone mode, or somebody who's more fit and active, you would start off with the tone mode. But the tone mode really breaks up into 2 sections. It begins with 3 different exercises that are being simulated. Each one lasts 2.5 minutes. And when you have the 3 exercises for 2.5 minutes with a rest in between each one, that creates an 8-minute set. And those 8-minute sets are then duplicated 4 times. And that creates your first 31-minute workout with the tone mode. After that, you go into what I call the interval training. The interval training is where you do the same high-intensity exercise for the last 14 minutes. And that's what's going to increase your basal metabolic rate, because it's done at a very, very fast level. So as we talked about before, with the carrier frequency and the beat frequency, the carrier frequency is determining which of these exercises you're replicating, and the beat frequency is determining how fast. So these last 14 minutes is a high interval training because the beat frequency is incredibly fast. Once we move into sculpt mode, you're basically doing the same thing you do in the tone mode, but the time at which you do each is different. So instead of doing 4 sets of 3 exercises, you're doing 2 sets of those 3 exercises. So you have 16 minutes of those of the 2 sets, and then followed by 29 minutes of the high interval training. Now it should make more sense when you see this slide about our multi-directional stimulation and how the prep, tone, and sculpt modes work. So when you're in prep and you're creating these twisting actions based on how the hand pieces are placed in a crisscross formation, you're able to stretch the muscles and slowly build tolerance and really get the muscles ready for the tone and the sculpt modes. In tone mode, this is where the contractions get more intense, and you're able to really exhaust the muscles and enhance your endurance. And then in the sculpt mode, this is where the contractions are very fast, deep, and the sequential formation is allowing you to really increase your basal metabolic rate and really sculpt those muscles. There's been a lot of confusion about how this treatment is different than our TruSculpt ID as far as how it affects the fat. TruSculpt ID, as you know, is a fat destruction device. And with TruSculpt Flex, we're building muscle mass. We do see changes to the fat, but we're not destroying the fat. What we're doing is, in fact, contracting the fat or decreasing the size of fat cells, much like you would do with exercise. So when we look at the ultrasounds and we see the muscle mass increase, we are seeing the growth of new fibers being developed in the muscle. But where we see a decrease in the fat, we're looking at the contraction of the fat. As the muscle increases in size, the fat is compacted within the same area. And that's because the size of the fat cells are decreasing, as well as from a higher metabolism that we're creating from doing TruSculpt Flex, you're able to see a much leaner appearance from the outside. Now we'll do a review on the treatment protocol, as well as talk about some information that's new. I'm sure you're all familiar with the contraindications, but just as a quick review and based on some of the questions that we've had, the top contraindication is a cardiac pacemaker, defibrillators, implanted metallic or electrical devices. So this does not include non-metallic or non-electrical devices. Other implants in the body are perfectly fine to treat with TruSculpt Flex. Also to note, with a hernia, if the hernia has not been repaired, it is a contraindication, but a repaired hernia is perfectly fine. We have an additional list of warnings, and again, just to review some of the questions that we've received of these warnings, the most common question that we're asked is about treating the pecs. And this is an area that, because it's so close to the heart, we do not recommend treating over the chest or the upper back area as it's close to the heart. The TruSculpt ID and TruSculpt Flex devices are great to use in a pairing fashion. If you want to treat a patient with both of them at the same time, you can do that, and we recommend using the TruSculpt ID first. And then you can immediately follow it up on the same day with and right afterwards with the TruSculpt Flex treatment. The reason you would do the TruSculpt ID treatment first is because after a Flex treatment you have some numbness, and you want to be able to have feeling in the area that you're treating in order to appropriately adjust the temperature settings for TruSculpt ID. So for that reason, we put the TruSculpt ID first, and then you can immediately follow it up with the TruSculpt Flex. When selecting the handpieces that you're going to use, you can use up to 16 all on one patient at the same time. And those handpieces are all color-coded. So there's 4 different channels that are all color-coded. So the first channel is yellow, the second channel is green, the third is purple, and the fourth is blue. Within those channels, you can select different modes, and you can also have multiple different modes running at the same time. So for example, if you had all 4 handpieces on the abdomen that are yellow and you put that into prep mode, you could put 4 other handpieces on a different channel in the tone mode and put them on a different muscle group. So you can definitely do that. However, once you select the mode, that mode will stay in a set position for the entire 45 minutes of the treatment. Each handpiece needs to operate as a pair. So there's, for example, the one pair, there's a 1 red and a 1 black. And you always need to have both of those on either the same muscle group or alternate or adjacent muscle groups so that they're working together. You don't, however, have to use all 4 handpieces at the same time within the color channel. So if for some reason you only wanted to use 2, you can just allow the other 2 to dangle. But you would want to select the red and the black, at least from the same number within that pair. As for the treatment sessions, we recommend doing a minimum of 4 treatments, and more treatments based on the patient's goals as well as their fitness level. So we start off all the patients either on prep mode or tone mode, but you never want to start on the sculpt mode. You do need to prep the muscles and get the patient acclimated to the way the muscles are going to contract using TruSculpt Flex before you're bumping them up to the next mode. So if a patient is not active, you would do the prep mode twice, and you would then follow it up with the tone mode at least twice, and then moving into the sculpt mode twice. And then all of your maintenance treatments thereafter would be a single treatment spaced 1 to 3 months apart, or however you choose to do it based on the patient's goals. When you're setting up their treatment protocol, you want to have a minimum of 2 days between each treatment, but not more than 7 days. If a patient is active and in very, very good shape, you don't want to start immediately on the sculpt mode. You still need to start with the tone mode, because this is a very different type of exercise or activity than what a patient would do in the gym. So we always start with the tone mode. In order to properly prepare your patient for the TruSculpt Flex series of treatments, you do want to have them hydrated on the day of each treatment. Also take before and after pictures, obviously the before pictures before you start your series, and the after pictures at the end of the series, and then periodically up to 12 weeks following the last treatment. Patients should use the restroom before they begin the treatment, and also have your patient remove any jewelry in the area of the treatment. They don't need to take off jewelry from other areas. The treatment area should be shaved so that the TruGels will have good contact with the skin. And the skin should be clean so that, again, the contact with the TruGel on the skin is a good contact. There's no need for any anesthetic prior to the treatment because this is supposed to be a comfortable treatment and you want to get patients up to the highest tolerable intensities, but it won't be painful. The best way to position your patient is to first place the cummerbund and the wraps on the treatment table in the areas where you'll be treating the patient before the patient lies down. You'll also want to mark all the bony areas as well as the treatment areas with a white chalk marker or an eyeliner once the patient is lying down. You want to position the patient so that they're comfortable because they'll be there for 45 minutes, as well as to make sure that you're able to see all of the treatment areas and make adjustments as needed. When placing the TruGels in the handpieces, you'll have the patient lying down, and you're going to start off by removing the label that says skin side from the TruGel, and then you'll adhere that to the patient's skin on the treatment area where you've marked your X's. Then you'll remove the outer facing side of the TruGel liner, and you'll be able to place the handpieces directly onto the TruGel. You'll want to put one handpiece at the top of the muscle and one at the bottom of the muscle. The handpieces should be placed on a single layer of the TruGel so that none of the metal is touching directly onto the patient's skin. If you have an area where the TruGels are overlapping, you just want to make sure that you remove that from the area where you're treating. You want to ensure that each of the handpieces is clean and dry prior to placing them on the TruGels. The handpieces can be very close together, about 2 centimeters apart, and no more than 8 inches apart. The handpieces should not be placed over any metallic or electronic implant. As I mentioned before, if it's another type of implant, it's fine. You'll want to ensure also that the handpieces are not placed over a bony area. If the handpieces are on a bony area, the patient will most likely feel some sensitivity in the area, and you'll need to pause the treatment to readjust the handpiece, and then you can resume the treatment. The handpieces should only be placed over muscles, and you can palpate the area to ensure that you've correctly placed the handpieces onto the correct muscles. Now let's review the configuration for how we place the handpieces for the 3 different modes. We've made a few changes and updates based on feedback in the field, and so I want to go over these with you in more detail. So as you can see from the picture, the handpieces on the outer sides of the obliques are truly wrapped around the edge of the oblique in order to properly contract the entire length of the muscle. The handpieces for the prep mode are aligned in a crisscross formation so that your positive and your negative pairs are across 2 different muscle groups from each other. This image again shows the proper placement for aligning the handpieces on the oblique to get the top and the bottom of the muscle fully to contract during the treatment. And then you can see the top and the bottom of the abdominal muscles in order, again, to get the most contraction out of the length of the muscle. These images show that you can select the muscle group that you desire and place the handpieces exactly where you want to put them. For the lower body, the muscle groups, you have many to choose from. So as you can see, you can choose whether it's the general quad muscles, the inner and the outer thigh, but you're able to select the muscle group that you want and appropriately place the handpieces as you like based on the patient's goals. Generally, men like to have the handpieces lower down to fully engage the quad muscles from right above the knee. And women often like to engage the muscles on the inner thigh and outer thigh. It's up to you to select the muscle groups that you are looking to improve, and then you can place the TruGels and the handpieces as needed. On the back side of the patient, you have many muscles to choose from, again, on the back of the legs. So if you're looking to contract the muscles from the hamstring or some of the other muscles on the back of the leg, you can select the muscles that you desire and place the handpieces appropriately. On the gluteus maximus, you have one large muscle that runs diagonal. So much like the obliques, we're aligning the handpieces to run along the grain of the muscle. So the handpieces are not designed to go up and down. They're designed to go across the length of the muscle. So you can see the way the handpieces are placed. Again, it's in the horizontal fashion so that you have your positive and your negative handpieces contracting across the muscle, but the pairs are going in a diagonal formation. With the tone mode, you can see that we've made some changes to the protocol. Initially, when we launched the product, we had all of the handpieces that were yellow on one side of the abdomen, and all of the handpieces that were green were on the other side. What we have found is that by doing that, you can't challenge the obliques and the abdomen muscles individually because the channel was working together. So our suggestion now is on the tone mode to break up the green channel and the yellow channel so that you have all the yellows on the abdominis rectus muscles and you have the green on the obliques. This way you can individually adjust the % that you need to challenge each muscle group individually. The actual placement on the oblique muscles and the abdominal muscles is in the same place. It's just the channels that we've adjusted. With the tone mode, we've also changed the directionality of the contractions. So instead of the contractions going diagonal across two muscle groups, they're now going linear. So your positive 2 is going directly down to your negative 2, and they're working in a linear fashion. This is a nice picture to, again, show the proper placement for the handpieces. The lower body for tone follows suit with the upper body, that you're now directing your energy from positive to negative within the same set. So 5 goes to 5, 6 goes to 6, etc. We're no longer crisscrossing across the legs. On the back side of the patient, the handpieces again on the gluteus maximus will run along with the grain of the muscle in a diagonal formation, but we're again not crisscrossing the handpieces from one side to the other. They're now going in a linear fashion, just like the front of the body, and the same with the back of the legs. We've also made some changes to the sculpt mode. In the past, you had one option with sculpt, which was to have all of the yellow handpieces on one side and all of the green on the other. And as you'll see in the next couple of slides, you now have two choices. So the first option is the sculpt mode to challenge the obliques. If you find that when you're in tone mode, that the intensity difference between the obliques and the abdomen are more than 10% difference, you're better off using this formation for how you're going to place the handpieces when you're in the sculpt mode. And this way you'll continue to challenge individually the abdominal muscles and the oblique muscles, and you can adjust them to make sure you're at the maximum tolerable intensity for each. If, however, you find that the difference in the intensity between the abdomen and the oblique during tone mode is less than 10% difference, then you'll want to continue to use the former sculpt mode formation of all of the green channel on one side and all of the yellow channel on the other side. In this way, you're able to take advantage of the sequential motion of the way the sculpt mode works, of moving the energy all the way around the different handpieces in a square formation. The sculpt mode for the lower body is exactly the same as the way we put the handpieces on for the tone mode. The difference is now your handpieces are moving in that square formation and sequentially moving the energy within the entire grouping of the purple handpieces and the blue handpieces. The back side of the body is exactly the same as the front lower part of the body, and you will now be able to have each of these channels or each of the colors working together to move the energy throughout the square formation. When you're ready to start the treatment, you'll select which of the modes that you want and which channel you're using. So if you're using all 16 handpieces, you'll select all 4 colors with the select button. Then you're going to select which mode for each of those channels, and then you'll hit the start button. Once the treatment starts, you can use the big plus/minus button to adjust all of the intensities all at the same time. You want to get the patient up to a point where they just start to feel the tingling sensation, and that's where you're going to leave the intensity for the first 2 minutes of the treatment. We've also updated our treatment parameters slightly. You'll be able to download an updated copy from this webinar tool. We will also send them to you in the coming weeks. So based on the new treatment parameters, you'll continue to bring the first setting up till the patient just starts to feel the tingling sensation, and then once you hear the audible alarm after 2 minutes, you'll increase it to between 20 and 45%, or even higher depending on how many times the patient's had the treatment, but you're getting them up to a point where they feel strong muscle contractions. At the end of the first 5 minutes, you'll hear an alarm again, and that's when you're going to increase to the highest tolerable intensity for each of the individual muscle groups or each of the channels. At the end of 10 and 20 minutes, you'll hear the sound again, and you'll continue to increase each individual channel to the highest tolerable intensity. Every patient is different, and every muscle group is different. So there's a wide range, and you just want to ask the patient how they feel and challenge each individual channel until they can't tolerate a higher intensity. Once they have 15 minutes left on tone mode, you'll want to bring the settings down, or the intensity down, about a minimum of 10, if not 20%, because the intensity will kick in at a higher level once it goes into that last 15 minutes. And if you're on sculpt mode, then it will be the last 30 minutes you'll bring the intensity down, and once it hits 29 minutes remaining, it'll jump into that higher intensity mode. Once the patient has gone into that higher intensity mode, you'll want to give the patient about a minute or 2 to acclimate, and then you can start to titrate the intensity back up. You may never reach the same intensity that you were at before, and that's okay. You're just, again, going to ask your patient how do they feel and increase the intensity to the highest tolerable intensity. Once the treatment has ended, you're able to open up the cummerbund or the wraps, and then you can carefully peel back the handpieces from the base of the handpiece versus the cable, and gently pull the white tab to peel off the TruGels from the patient. And if there's any residual residue from the TruGel on the patient, you can wipe them down, as well as to take off the white chalk marker. Now you can clean the device and the handpieces by using alcohol or a Sani wipe, as well as the cummerbund and wraps. You can hang the cummerbund and wraps on the cleaning station to wipe them down, or you can spray them with alcohol and wipe it down with a lint-free cloth, and return all of the clean equipment back onto the device and ready for the next patient. As a quick reminder, any of the treatment guideline information or clinical tools that you need, you can find them on the CAMP portal, as well as hundreds of marketing tools. If you don't have access to the CAMP portal, please send a message to us through this webinar, and we'll make sure to get you your login information. Taking good before and after pictures is incredibly important with any body shaping device. And as a reminder, we have some great tools for you to use in the CAMP portal. There's instructions on taking good before and afters, as well as you should have received your photography kit that came with the device. There's also a nice video on how to take good before and after pictures. If you have questions, please don't hesitate to reach out to us so that we can help you and make sure that you're getting great photos. We also love to purchase good before and after pictures from our customers, so please reach out to us with your before and after pictures, and if they meet our guidelines, we would love to purchase them to use them for our marketing materials. Our practice development managers are always available to help you and to support your practice. So just as a quick reminder, they are available for many different support services, and if you haven't been in touch with them already, there is a download with the contact information for the PDMs in each of the regions. So please feel free to download and be in touch with your PDMs. Qterra has a nice rewards program for all of our consumable products, which is the Secret, Juliet, TruSculpt 3D, ID, and Flex. If you haven't already signed up, you can go on to the camp portal, and at the very top or off to the right, there's a spot where you can click to register. We have some great benefits as you reach the different tiers within the rewards program. And lastly, we'd like to show you a quick video on how to refill your cycles. This video is also available on the camp portal as well as printable instructions. Please feel free to refer to this as you go to refill your cycles. Okay, and that was our last slide, and that concludes our webinar on the tips for advanced TruSculpt Flex treatments, and we're going to go ahead and open it up to the Q&A now. Thank you so much for your attendance.
Thanks, Elisa, for this presentation on best practices in TruSculpt Flex. So Before we go into live Q&A, I just want to thank everyone for joining us tonight, and also to let you know that this webinar will be archived on our website within 30 days. It may be sooner, but we will notify you when that happens. So we'll go right on to questions right now. The first question, Elisa, how do you minimize getting the TruGel sticky residue on the handpiece, cables, and wraps?
So we had some challenges with our very first batch of the TruGels that went out where they were pretty sticky. But the newest batches, it shouldn't be an issue. The best practice is to always use the side that is labeled skin side and stick that side onto the skin directly. Because that is the stickiest side. And the other side that doesn't have a label on it is the side that the handpieces will be placed on. And when you're putting them in that right side up like that, there shouldn't be any issues with the residue from the TruGels getting onto the labels or the cables or the wraps.
Thank you. Also joining us at this question and answer period is Amol Kotare, who is our VP of Clinical Affairs. And so we've asked him to join us as he has some valuable insights into TruSculpt Flex and best practices. We have a question for you, Amol. How long does it take to see results?
So we have typically seen results anywhere between 2 to 10 weeks post the last treatment. We have actually, the typical results are seen anywhere between, the tighter window here to expect is 4 to 8 weeks.
Thank you. Elisa, someone's asking why you need to place handpieces differently for each mode.
Okay, so it's a great question, and this is one of the main changes in this latest round of treatment guidelines. And what we found, and with feedback from the field and from all of you, is that different configurations will really help us maximize the results. So in prep mode, that mode is exactly the same as it was from the beginning, and you'll place the handpieces across 2 different muscle groups. So the pair, you'll still use one pair, and the energy is still delivered between that one positive and negative pair, but it's going across 2 different muscle groups. And what that's doing is creating not only a strong contraction, but also a twist. In tone mode, you're placing the handpieces. Now we have each color channel broken up when you're placing them on the abdomen. So you have all of one color channel in the center of the abdomen, and then you have a different color channel that's broken up between the right and the left obliques. And what this allows us to do is to maximize the intensity individually for each muscle group. So you're able to increase the obliques to, if needed, a higher intensity than the abdomen. So that, again, is really helping us to achieve better results. When you're in the sculpt mode, you have 2 options. So you're able to either choose to continue to challenge the obliques in the same formation that you did with the tone mode, or if you found that the intensity difference between the obliques and the abdomen was less than 10%, then you can go ahead and keep all of one color channel on the right side of the body and the other color channel on the left side of the abdomen, for example. And that way you're getting what we call a sequential movement of the energy, and that's giving you not only a nice strong contraction and a twist, but the entire color channel is working together to achieve a stronger contraction and at a higher beats per second to increase your basal metabolic rate.
Thank you for the thorough answer. Amol, got a 2-part question here. First part is, can you please review again how many treatments you need for the initial treatments to be effective? And then the second part of the question is, how many maintenance treatments are needed?
So typically, we prescribe 4 to 6 treatments, with 6 treatments for patients with sedentary lifestyle and with 4 treatments for patients with slightly active lifestyle. In terms of maintenance treatments, we've seen that it's really a patient subjective question. It depends on the expectation set by the patient. And typically, we recommend maintenance treatment in the sculpt mode from 1 to 3 months, depending on the expectations. But just one sculpt treatment.
Great, thank you. Next question we got here is, what tips can we do to make sure, what tips can we take, to make sure that we are getting the best results? I'm going to pass that on to Lisa.
Okay, so some of the things that we've seen in our customers that are getting the best results, these are some of the advanced techniques that they're doing. So for one, they're always marking the bony areas, and by doing that, you can ensure that when you place the handpieces on the patient, it's hard to palpate the area once the TruGels are in place. So if you mark the bony areas in advance so that when you place the handpieces on, you won't be on top of a bone. If you are, it's going to be uncomfortable and you won't be able to achieve the highest intensity. So as long as you're off that area, you'll be able to achieve a much higher intensity, which of course goes towards achieving great results. Also, many customers are just placing the handpieces just kind of randomly on the abdomen or on the legs without necessarily targeting a specific muscle. So the best results that we're seeing are really coming from customers who are flexing the muscle. So let's say you're treating a leg. You would have the patient flex their foot so that you can really see the leg muscles pop. Figure out which muscle group you're trying to target. Is it the outer thigh, the inner thigh, the center of the quad? And then really palpate that muscle and mark the top part of the muscle and the bottom part that you want to, that you're trying to contract. And put those X's on again before you place the TruGels on so that you're ensuring once the TruGel's in place that you have the handpieces in the right place, again, to achieve the best results. And the third thing that we're seeing as a best practice out in the field is you have two muscles that don't run vertically. They run more diagonally, and that's your obliques as well as the buttocks. So when you're treating the obliques, you want to make sure that the handpieces are running along the grain of the muscle, which is at a diagonal. Same thing with the buttocks. It runs along a diagonal. So when you're placing the handpieces, you want to be at the top of the muscle and the bottom of the muscle, but that's not going to be at the top, that's not north and south on the patient itself. So you do want to run the handpieces at the same angle to follow the grain of the muscle. And those are really three things that we're seeing that are attributing to great results.
Thank you. Amok, we have a question about intensity. Someone's asking, what intensity should our patients reach?
So this is, again, a very subjective question. It depends on individual patients. But in general, we recommend practitioners to always push the patients to their highest tolerable intensity. There's, as they say, if there's no pain, there's no gain. So there's no set number as such, and each patient varies in the final intensity level reached, depending on how fit they are and how active they are.
Thank you. Next question is about placing handpieces. We have a user is asking, is it better to have the electrodes closer or further apart from each other?
So we prescribe, the separation distance between an electrode pair anywhere between 2 centimeters and 8 inches, and this is what we've tested. Now, it could be longer than that, but we haven't tested that. So we prescribe right now, for now, to have it anywhere between 2 centimeters and 8 inches.
So there's no, it's not better or worse to have them closer?
So shorter muscle groups require shorter separation distance, and larger muscle groups like your hamstrings and your femoral, anterior thighs, they will require longer separation distance. Again, it also depends on the mode of selection. Prep mode requires longer separation distance than tone and sculpt. So yeah, it depends on the muscle group and the mode of treatment.
Great, thank you. Elisa, are there any tricks to getting patients who are a little anxious about the treatments to get them to a higher intensity level?
So one of the great tricks that I've heard is sometimes it's just the noise of the beeping when you're increasing the intensity that makes a patient a little anxious because they know that you're increasing the intensity. So if you go to the settings and you turn down the beeping or you turn the beeping off and you're still following the treatment guidelines as to when to increase the settings, the patient is no longer anxious and you're able to achieve a higher intensity setting because you don't hear that beeping and they don't get nervous. So that's something you could certainly try.
Could you get them to listen to their music? Is that another option that they can do?
Absolutely. TV in the room, your cell phone, also listening to music, having headphones on, just by merely talking to the patient, asking them about their day, distracting them about the weather, their family, talking, of course, about cross-selling to other procedures that you offer. Those are all great ways to lower anxiety and allow you to increase the intensity without your patients being anxious about it.
We like to call that talkathesia. So I've got another question here. Amog, this would be, I think, good for you. Have you developed any protocols for arm and deltoid muscles?
So let me start off by saying that we are not cleared for arms and deltoids forming of the muscles in that area. However, we have direction from our medical director, Dr. Steve Ronan, and some of our accounts that have reported some results with a particular treatment protocol that we are willing to provide. But yes, the protocol development for arms and deltoids is in progress, and we're looking at it.
Thank you. So I've got time for one final question. I know, Amog, you covered this briefly in one of your previous questions, but a user that's asking, when is it best to take after photos, and possibly you might want to talk about before photos as well, too. So if you want to go talk about the protocol before and after photos, that'd be great.
So I think it should be, so the photos in general should be taken in the morning, in terms of the baseline pictures before the patient has had heavy breakfast or what have you. But then in terms of the after pictures, in terms of the time points, we have seen results that, are showing as early as 2 weeks, but typically we see patients respond, anywhere between 4 to 8 weeks where the results peak. And I can speak from personal experience that that's what I've noticed too. And again, when you select a time of photography for the patients for their baseline pictures, please try to maintain that time of the day for the follow-up pictures as well.
Would you also recommend that for follow-up pictures that people wear similar type of clothing, or the clinic provide undergarments so that you have a baseline that's going to be sort of apples to apples for comparison?
Very good suggestion. We have a photography protocol that we can share with this group, which speaks exactly to your point, Gina, that we need similar attires. The positioning of the garments should be identical or very close to the baseline pictures. And one thing that cannot be underestimated is lighting. So if you have a front flash on your camera and you wash out your abdomen or your treatment area, then you're not going to see the striations or the tone or the contour of your intended area of treatment. Conversely, if you have flashes at angles that depict contours, then it's better to show, it becomes easier for you to show the results in your follow-up pictures.
Thank you, Amog. So that is it. That's all the time we have tonight for questions. Any other questions that come in, we will ensure that those get answered by our team here. And once again, thank you very much for joining us this evening. And look out for the archive webinar that's going to be posted within 30 days. Amog, Elisa, thank you for your time tonight.
Thank you, Gina.
Thank you all. Thank you, Gina.